1, 2, 3.
You just put yeah and nah.
Yeah and nah.
Yeah, actually, yeah. Why? Okay, do you guys know what singing bowl is?
The wong wong wong. We'll put a picture here.
Okay, so why is yeah and nah? Okay, basically, singing bowls, they kind of have like a relaxing effect.
Therapeutic properties,
Properties,
and
yeah.
you have healing properties. Some people believe that it has healing properties. The metal one or the crystal one.
Unfortunately, relaxing is technically not really just like a clinical goal per se.
If you have a medical issue, like you have really high anxiety, well, relaxing is technically a clinical goal.
But I've also met like patients who are like highly sensitive to this kind of frequencies and this kind of sound. So would it be relaxing to everybody? Not really,
Yeah.
So it's kind of like yes and no. And plus, like we do use like maybe like singing bowls in like our session, like music therapy session, as like an intervention when it is correctly applied by a certified
Trained professional, yeah. And I think singing bowls is really therapeutic. Like, at least for me, I love the crystal singing bowl, and I do use it for my patients who are in a lot of pain and they're not able to calm down, and we want to try to help them meditate. Yeah, so it's like we provide guided meditation for them to relax and decrease the pain that they are going through. Next. 1, 2, 3. Nah. Why don't you tell us
So,
who can receive music therapy?
do you adults listen to music? Have you adults played any instruments before? Do adults like music too? Do babies kind of like music too? Basically, if you have a clinical goal that we can work on, and you kind of prefer music as like your tool. Yeah,
That's
as a
right.
medium. So music therapy would be very much beneficial and suitable for you. Okay, but it is not just for special need kids.
Yeah, it addresses physical needs, emotional needs, cognitive needs, speech,
Communication,
communication, and social.
social skills. Yeah.
Yeah.
Okay.
Like, how about babies?
Yeah, and as
How young or how old
So,
is the limit? for
basically,
music
like
therapy?
when we were mentioning like babies who are like developing their hearing at like 25 weeks. So we have like premature babies. Premature babies means they are born
Babies who are
before-
born
before their term.
Yeah, right.
So we can use like a very specified technique, very specified like volume and like playing and singing and talking, touch even, very specific, anything that is specified techniques for a premature baby is called like a NICU music therapy.
Yeah, NICU means neonatal intensive care unit. So why it's called neonatal intensive care unit is because that all premature babies are usually transferred there right after birth or right after a C-sec. You would have the baby in the NICU for a period of time until that they're healthy enough or they've reached 4 pounds before that they're able to discharge. And they have a list of things for them to be discharged, but one of them is 4 pounds of weight and then endure sucking and latching on to the bottle or a mother's
Heart rate,
breast and things like-
stabilization,
yeah.
breathing, all that. Yeah.
Right. Then how about like how old can
Ooh.
what's the limit for music therapy?
I guess like as old as they can get. Yeah.
Yeah, it's literally for everyone who has like a clinical goal to achieve.
And an openness for music, I guess.
Yeah. Yeah. And clinical goal can include like like we said, anxiety or depression and things like
Include
that.
like family goals as well.
Yeah,
you know.
like mental health and things like that. So, okay, next. Unfortunately, nah.
We have seen a lot of like doctors or like other medical professionals who have like played at bedside for their patients.
Okay, don't get us wrong. We really appreciate that people are using music as a therapeutic tool for everyone, and know that music therapists do not own music. Okay, it's not that because you're a speech therapist or occupational therapist or physical therapist you can't use music, because once you use music you are out of line.
Yeah, but we just
It's
don't
not like
call
that.
it music therapy.
Yeah.
Yeah.
Yeah. Just like,
Well, it's kind of like if let's say like, you know, these days we have a lot of like YouTube videos for like workout and stuff like that. So let's say if I put an iPad in front of me, okay, and I have like a bunch of people, and I work out together following with a YouTube video, can I call myself a gym instructor?
right.
Yeah.
And just like music therapy, sometimes we work on speech as well, but we would never call ourselves speech therapists.
Yeah, we've been going on motor skills, we're not physical therapy. You know, we
That's
kind of
right.
just complement like a lot of goals
That's
and a lot
right.
of areas.
That's
of
right.
needs.
And you know, we work a lot, you know, together with other therapists as a multidisciplinary team for our patients too.
Speech, physical, OTs. OTs is occupational therapists, psychologists, counselors, doctors too.
Yeah, they are the best ones because they refer like their patients to us, and then we go to them. So we really need doctors to be helping us in our profession. Next.
Drum roll.
Unfortunately, there is no universities.
Who are currently offering like music therapy courses. Yeah.
Yeah. So where can we study music therapy then?
So we can go to Australia. We can go to China. Even has like their own program now.
Taiwan?
Yeah, Taiwan too. Japan also has.
Yeah.
US, UK.
Right.
I know Europe has like tons of like universities over there. But probably like the closest one is like Australia. That
Yeah.
I can think of.
Yeah.
China's kind of pretty close too.
Thailand maybe, I'm not sure.
I'm not sure about that.
Yeah, I'm not too sure about that, but you can check it out.
What about South Africa?
I'm sure,
Yeah.
yes. Yes, I think Pretoria offers it, University
Yeah.
of Pretoria. Yeah. But yeah.
Yeah.
And also to be a music therapist, like if you're not sure what it is, you can take like degree in psychology or degree in music before
Furthering your study.
in masters
Yeah.
in music therapy. If you're not sure if you really do want music therapy and you want like more options, you're like trying to have more options for yourself, then I think you can start with having a degree which is not music therapy specifically. And there are actually not many schools that offer degree in music therapy.
Actually, yeah.
Yeah, only the
The
States,
states do.
I think. Yeah. Because it does take 5 years for us to achieve our degree in the States. So if you're doing a degree in something else, 3 years, and then masters an additional 2 years, that's 5 years too. And then at least you get a master's.
Yeah.
Yeah. But
But do check out like some websites like music therapy organization websites that you can know more about. You know.
or you can contact the music therapy Malaysian Music Therapy Association in Malaysia,
MMTA.
yeah, if you are interested in it, and maybe we can answer some of your questions there too. Okay, next,
All right.
what do you think?
After all the information that has been given to you, what do you think?
Yeah.
Why?
You tell me what.
Every time I tell you why. Oh man. Okay, so basically like when somebody suffers from stroke, okay, that means part of their brain has probably been like damaged. And that's where neurorehabilitation comes in.
It's called neuroplasticity. I love that word.
Yes, and music, fortunately, engages many parts of your brain. Almost
Every
all parts
part
of
of
your
your
brain.
brain,
Why are
yeah.
you so enthusiastic about this?
Because
But-
whenever we talk about the brain and music, it just excites us.
Because how music engages all parts of the brain, music therapy can be used to address physical goals, speech goals, what else? Cognitive goals. You know, sometimes like people after they suffer from stroke, they have like decision making skills that are kind of affected. You know, so cognitive skills are
Hand-eye coordination,
Yeah.
speech. I don't know if you said that, but
Yeah.
yeah. Is every music therapist able to work with patients with stroke?
I would say yes, but there is a very like specified training that music therapists can get to know specifically how to work with any neuro diseases.
Neurological
And that's called-
disorder, I guess.
Yeah, that's
Patients
more
with neurological disorder.
that's called
NMT. Neurologic Music Therapy.
So neurologic basically means like functions of the brain and stuff like that. So neurologic music therapy is like an very very specific evidence-based training and techniques that music therapists who are certified know how to use the interventions.
Right. So like we treat patients with Parkinson's, helping them to, I guess.
Gain more control of their movement.
That's right.
Because like unfortunately there are a lot of neurological disorders that are like going to deteriorate very fast. So we try and maintain that function of them using their hands, their feet,
Right.
their speech, everything.
And Alzheimer's patients as well with their memory, and stroke, of course, with their walking gait, and also speech. Most stroke patients lose their speech when their left brain is affected. So as music therapists, we would try to use music again as a medium to
as a
address all these issues and needs. So we have come to the end of our video, and we hope that you learned a thing or two about music therapy from us. If there are any questions, feel free to comment down below and ask us so that everyone can share the information. And if you don't like this video, like this video. If you like this video, like this video.
subscribe.
Okay.
Hit the bell button to get the notification.
Okay. Thank you everyone for watching. See you next time. Bye.